Good afternoon, ladies and gentlemen, and thank you for being here today. I would like to talk to you about donating blood and why everyone should. This is my audience. And hopefully by the end of my speech, I'll have persuaded you to go out and give blood. First, there are many benefits to donating blood, not only for the recipient of the blood, but also the donor. Once you donate blood, it makes your body create new red blood cells, which is very good and healthy for you. And it also helps prevent heart disease. It does this by lowering your iron level, and iron causes the arteries to harden, which will lead to heart disease. Also, donating blood is very good for the recipient. When you donate blood, there are many components in the blood, and the blood can be separated out to plasma, platelets, and red blood cells. And each of those are for different purposes. You never know. Most people will receive a blood transfusion at some point in their life. I did not know that. I did not realize that until I started the research for this project. Anybody could receive a blood transfusion, whether you're a surgery patient, a chemo treatment patient, if you're in an automobile accident, several reasons that people need blood. So I strongly encourage you to go out and donate blood. One of the sources for my research was the American Red Cross, and there are several facts about blood needs. One of those, every 2 seconds, someone in the U.S. will need blood. More than 41,000 blood donations are needed every day. The blood type most often requested by hospitals is type O. Negative O is the universal blood. Anyone can receive type negative O blood. So if you're in an automobile accident, or when a baby is first born, if you need blood, if the baby needs blood and they don't know yet what type of blood you are, they will give you negative O, because anyone can have that. Sickle cell disease affects more than 70,000 people in the U.S. About 1,000 babies are born with the disease each year, and sickle cell patients will require frequent blood transfusions throughout their entire lives. More than 1.6 million people were diagnosed with cancer last year. Many of them will need blood sometimes daily during their chemotherapy treatments. And a single car accident victim can require as many as 100 pints of blood. This is because once they are at the hospital and they're bleeding, doctors may not be able to find where the bleeding is coming from. And until they can find that and stop the bleeding, they are constantly having to give the patient blood to save their life. Facts about blood supply. The number of blood donations collected in a U.S. year is 15.7 million. There is an estimated 38% of the population that is eligible to donate, but less than 10% actually do. That's staggering numbers. 10% of the population will donate blood in a year. This could be because the two number one reasons are I just don't think about it and I'm scared of needles. But the professionals that take the blood are so trained that it's just an everyday thing for them, and it only takes about 10 to 12 minutes to actually donate your blood. Also, blood cannot be manufactured. Only thing that can produce blood is the human body, and it's so critical for you to donate blood because of that reason. Again, there are 3 types of transfusible products that can be derived from blood: red cells, platelets, and plasma. Donors can either give whole blood or a specific component only. A lot of places will pay you for your plasma and your platelets. The American Red Cross they will not pay you, and they will only take volunteer donors. Most donated red blood cells must be used within 42 days of collection. Donated platelets must be used within 5 days. Plasma is stored in frozen containers and can be kept up to 1 year. Your body is constantly making a supply of red blood cells, plasma, and platelets, so it's very safe and, again, healthy for you to donate blood. The supply is critically low right now for blood. Patients are having surgeries, and they're going in and finding out that their surgeries are being postponed because the storage of blood at the hospital is not there, and they have to save it for critically ill patients and accident victims, people that come in emergency situations. One of a personal testimony that I have, my mother went in for a knee replacement, and after her surgery she had lost so much blood that they had not expected to happen, and a couple of days after, her body was not reproducing red blood cells like it was supposed to, and she actually had to have 2 units of blood given to her. Could you look at a loved one? Look around at the room right now, to your friends and your family. Could you look at them and tell them you would not save their life? No, I'm sorry, I can't donate blood to save your life. You never, ever know when you will be in a situation where you may need it or a close friend or family loved one may need it. It's critically important to donate blood. I urge you and I dare you to go out today or sometime very soon and give the gift of life. You could save up to 3 lives by donating 1 pint of blood, and I urge you to do that immediately. Thank you.